They said it was just anemia. That feeling tired was normal. But what no one told you is that this simple anemia can kill, silently, slowly. While many doctors still downplay the disease, patients continue to suffer in silence, unaware they carry a genetic time bomb in their blood that could have been diffused from birth. And here's the shocking part. This disease has a name, a clear diagnosis, and even treatments that can change lives. But you know what's missing? Information. The kind that doesn't come up in rushed doctor visits or basic checkups. If you want the truth, the kind few dare to speak, stick around. Because what you're about to learn today could literally save a life. It's surreal to think that a tiny prick on a newborn's heel can reveal so much about their future. But that's exactly what the heel prick test does. It has the power to detect serious genetic conditions, like sickle cell disease, before the baby even takes their first steps. This disease, caused by a specific genetic mutation in the hemoglobin gene, disrupts the shape and function of red blood cells, the ones responsible for carrying oxygen throughout the body. Instead, they become stiff, sickle-shaped cells that clog vessels and trigger painful crises. Catching this early in life can mean the difference between a normal childhood and one filled with hospital visits. And why does this happen? The answer lies in our DNA. Specifically, chromosome 11. When a child inherits the altered gene from both parents, each carrying the sickle cell trait, they develop the disease. It follows a recessive inheritance pattern, meaning if only one parent passes it on, the child may not show symptoms but still carry the trait. That's why genetic counseling is so crucial. Many couples have no idea they carry this trait until a child is born with unexplained symptoms. A simple genetic screening before pregnancy can shed light on potential risks and help avoid blind decisions. If science already knows all of this, why are we still failing? Because genetic education hasn't reached where it needs to. Even today, doctors often overlook or underestimate the power of early diagnosis. People grow up with chronic fatigue, constant pain, episodes of dactylitis, and no clear explanation other than it's stress or maybe anxiety. It's not stress, it's mutated hemoglobin. The blood is screaming, but few know how to listen. And when you have access to knowledge like this, it becomes almost a duty to share it. Awareness is the first step toward prevention, especially in communities with limited access to healthcare. The family's role in all this isn't secondary, it's strategic. Informed parents know that babies need more than diapers and love. They need complete testing and proper medical follow-up. Understanding what red blood cells do, how hemoglobin works, and what a genetic mutation means is the least an adult can do for a child. And if you're someone who values knowledge and cares about the next generation's well-being, then you know what to do. Hit that subscribe button, drop a like, and share in the comments what stood out most to you so far. Because next, we're diving into what happens when the body starts screaming, and no one understands what it's saying. Some people spend years hearing from doctors that everything's fine, even when their body keeps saying otherwise. In sickle cell disease, the body doesn't whisper, it screams. Loudly. Pain shows up out of nowhere, fingers and toes swell due to dactylitis, breathing becomes shallow, and exhaustion hits before you even finish your morning coffee. Sometimes, leg ulcers that won't heal appear. Other times, a stroke happens without warning. All of this because of misshapen red blood cells that can't circulate properly through the body. These sickle-shaped cells, caused by a genetic mutation that alters hemoglobin, not only carry less oxygen but also clog blood vessels and trigger inflammation. It's like your bloodstream turns from a peaceful river into a traffic jam. The complications stack up: blood clots, infections, lung issues, even organ failure over time. And here's the catch. Most people only realize the seriousness of it when they land in the ER mid-crisis. That's why spotting early signs is like learning to understand the body in a whole new language. But not all hope is lost. Despite the challenges, effective treatments exist to manage symptoms and improve quality of life. One major pillar? Hydration. Lots of water, every day. Powerful pain relievers help during crises, blood transfusions replace damaged cells, and medications like hydroxyurea can reduce their frequency. In some cases, a bone marrow transplant can even be curative. Of course, it's not simple or widely accessible. Still, knowing that there's a care roadmap ahead can make all the difference. And hey, if you or someone in your family has had unexplained episodes of intense pain, extreme fatigue, or recurring infections, it might be time to dig deeper. The body speaks, and in the case of sickle cell disease, it doesn't just speak, it begs. Knowledge saves lives. And what's coming next might sound like science fiction, but it's already being used in top research centers across the globe. A tool that edits genes and rewrites the fate of those born with this mutation. Imagine being able to correct a genetic mutation like fixing a typo. Sounds like sci-fi, right? But that's the promise of CRISPR technology. It allows scientists to directly modify DNA, replacing the faulty segment that alters hemoglobin with a healthy one. And yes, it's already being tested on people with sickle cell disease. The potential here is groundbreaking. Instead of just managing symptoms, we're talking about a real cure. A fresh start, not just for those living with the disease, but for the entire future of medicine. Now, if you think this mutation appeared by chance, here's a wild fact. It was nature's defense mechanism against malaria. In parts of sub-Saharan Africa, individuals with the sickle cell trait had greater resistance to malaria. This helped the gene spread among black populations over the centuries, especially in places like the United States, where the African diaspora is strong. That's why sickle cell disease is more common in black communities. The irony? What once protected people from one illness now brings another, and demands more attention, care, and investment in education. Lack of access to information is one of the biggest dangers. So many people find out too late or go through life never really understanding what's happening inside their own body. That's why education is such a powerful weapon. And you don't have to wait for anyone to start. There are amazing books like The Gene by Siddhartha Mukherjee, or documentaries on YouTube about CRISPR, genetics, and blood disorders. If you want to go deeper, check out genetic counseling centers or free online courses on genetic health. Knowledge is the only medicine with no side effects. So here's the real question. What will you do with everything you've just learned? Will you keep it to yourself, or share it with someone who needs it? The impact of information goes far beyond a click. It changes lives. And if you like this content, stick around. There's even a video on this channel called The Natural Cure for Tired Legs. Fast, simple, and proven. That pairs perfectly with what we've talked about here, especially when it comes to circulation and vascular health. Now that you have this rare knowledge in your hands, the question is, what are you going to do with it? Let it pass like just another video, or turn it into a game changer for your life, and maybe for someone close to you. How many times has your body sent signals that no one took seriously? Well, maybe now you know why. What if I told you that applying this information could prevent pain, hospital visits, and even save a child before they ever get sick? Start by looking into your family history, getting tested, and seeking genetic counseling. You don't need to be a doctor to understand your own body. And if you've enjoyed this journey so far, hit that bell icon, subscribe to the channel, and share this video with someone who needs it. By the way, if you're interested in health, especially circulation and tired legs, two symptoms deeply connected to everything we've talked about, I highly recommend watching The Natural Cure for Tired Legs. Fast, simple, and proven. It'll give you even more clarity on how to take smart, practical care of your body. Now tell me, what surprised you most in this video? Do you know someone with sickle cell disease? Had you ever heard of CRISPR before? Drop a comment below, and let's spread this powerful information together. Because sometimes, saving a life starts with choosing not to ignore the truth.